All right, so let's take a look at what the COVID numbers are telling us. I'm joined by Professor Francois Venter, head of Ezintsha, which is a group of academics and health professionals at Wits University focused on sustainable health solutions. Prof, thanks so much for your time. We don't as yet have the numbers, and we've seen this in the last few days, that the numbers have been coming through quite late in the evening. But it was interesting what happened yesterday. There was a great deal of confusion. On some of the graphs that were sent through, it said a national total of 18,000 odd new infections. On others, it said 37,000. This is apparently due to data from the public health environment that has been lagging. It's been outstanding. And even though they ask all institutions to bring it in daily, sometimes the stuff only comes in weekly. I'm just wondering, do you see that as a big problem? Is that going to mess with the modelling, or is it all just part of the process?
It's all part of the process. It sounds like a couple of days got dumped in one. And I think the public needs to understand that the actual infection rates are not the thing they must worry about. They must be laser-like focused on the hospital beds. That's the hard data that's going to tell us. The actual infection rates are just a proxy marker for what's happening out there. But the thing that should occupy us is how are we doing during December in terms of hospitalizations. That will tell us whether we can exhale over the next year and whether we can get the country back to normal. This is a bit of a storm in a teacup. You know, these numbers come, they go up and down every so often. It is an interesting trend, and it's a bit of a pity that this happened and confused people, but I really would not get too hung up on this little bit of a blip.
All right. Interesting, the issue of hospitalization. So quite a few doctors and specialists are saying it feels different on the ground. Our hospitals are just not under the pressure that we've seen. However, we have seen cases rise so quickly, whereas in previous waves, the cases rose less quickly. So surely we should still be cautious and wait a few more weeks until we're sure that we can say this Omicron is mild.
I think it is worth being cautious, but I do think the trajectory at the moment is this, towards a feeling, and that was perfectly feeling. It just feels different this time. You know, even with Delta in June, even with that major surge of infection, there was immediately pressure on beds and ICU beds in particular within the first week or two. And this time, we're not seeing that. My colleagues on the ground just say that it just feels different, the intensity of the infection. Now, that doesn't mean that next week we may not see a massive surge on the bed. So it probably is a good idea to be cautious, but it is hopeful. We are seeing cases, though, of COVID pneumonia, and my colleagues in hospitals across the country are saying they are seeing cases almost exclusively in unvaccinated people. So this virus isn't, it's not a wussy virus. It's still managing to break through. And if you are unvaccinated, you're still at risk. So get out there and get vaccinated. But the people who are, our immune systems are doing the work they're supposed to do. The vaccines are doing the work they're supposed to do. They're keeping people out of hospitals so far.
Of course, we've just heard from the United Kingdom a little earlier today that they have reported their first Omicron death. The Prime Minister Boris Johnson saying this is a very clear reason why we need to take this variant seriously, even while we're all hoping it might be a little milder. Here in South Africa, we haven't noted any specific Omicron deaths, but the Health Department is still seemingly going through that data.
So again, my colleagues on the ground, I think I probably would have heard if there had been a specific Omicron death yet. It is still early days. We haven't even had this thing around for 3 weeks yet. So I'm again cautiously hopeful that that deaths will be far, far lower than we had with the Delta wave. People need to remember that, there are very vulnerable people out there, people with cancer, with severe comorbidities that, a cold can wipe them out. This is what the problem with things like flu in any normal winter, is that, they're very vulnerable to the smallest assault. So, we will see deaths with Omicron, even if it is very mild. And that's why I'm not surprised that the UK has seen its first death. It will come. But, at this stage, that in South Africa, the fact that we haven't had major reports yet is reassuring. I think in the next week or so, that if we haven't seen a major increase in beds occupancy, that will be the signal that, as I said, that our immune systems, the vaccines are doing their job.
Even if Omicron is mild, due to the sheer numbers, and we're seeing a lot of infections and a very high positivity rate. I mean, it's edging closer to sort of 3 out of every 10 tests are showing positive. Are we likely to get to a point where our hospitals are under severe pressure? Because as you say, even if it's milder, there are still people who are vulnerable and who will end up in hospital.
I mean, it's staggering the number of people who have become infected. Just the people around me, my staff, my family, my friends, the people I know. This is certainly a very, very infectious virus. And people I know there's one person I know who's had it 3 times despite being boosted. So it's very able to break through the initial immunity of the vaccination or previous infection. So it's not protecting you from the initial infection, but it seems to be very good at protecting you from going to hospital. However, if it infects millions and millions of people, we just need a tiny proportion of those people to get sick enough to go to hospital to overwhelm the healthcare system. So the healthcare system still needs to be on standby in case, even if 0.1% of a million people get sick and need to go to the hospital, that's a lot of people. And we don't have a lot of sort of the spare capacity of, say, a much richer country. So, the health system is constantly on standby, particularly of the festive season, where people particularly displaced down to the coast and put a lot of stress on sort of Durban, Cape Town, the Eastern Cape areas in terms of their healthcare systems.
What do you think is going to happen in Gauteng in the coming days? Do you think the numbers are going to keep climbing really high? I mean, the numbers are not out for this evening yet, but what is the sense of where the numbers are going in Gauteng?
So some of the modeling work that's been done by the Gauteng people actually even suggests it might have even peaked already. There's some modeling that says it'll peak later this week, potentially even next week or even later, the week after. So we'll just have to wait and see. The data nerds are all poring over this data, hourly almost to look at it. The Gauteng waves have actually been almost metronomic in their 6-monthly sort of peaks over the last previous 3 waves, now the 4th wave. They've gone up very, very quickly and come down very quickly. So, we'll be able to tell the Gauteng wave probably more predictably than any other part of the country. But it certainly is starting to see the rest of the country. The reports across Cape Town, Durban, now increasingly from the Eastern Cape that I'm getting, and now from Limpopo and Northwest, suggests that they're going to be having their own waves going forward over the festive season.
And the numbers have just popped in. Shahan has just spotted them and sent them to me. So it seems new cases, and Mondays normally, traditionally, it seems to be a low day, maybe because of the weekend, but just under 14,000 new cases nationally, 13,992. Gauteng, 6,711. The Western Cape, 1,464, but KwaZulu-Natal really high, 2,715. But interestingly, the positivity rate is at 31%. Do those numbers suggest anything at this stage, or is it just too tricky until we've seen a good few more days of data?
I think it's sweeping its way through the country. I think that people need to anticipate this thing is going to be infecting huge numbers of South Africans over the festive season. And it's the non-sexy advice that people have heard over and over again is, stay outdoors as much as you can. If you're forced indoors, wear a mask, avoid crowds, get vaccinated as quickly as possible. It is possible to protect yourself this festive season, but just be aware that this thing is it appears to be much more infectious than our previous variants that have hit us. So just take extra care while you're out there.
So we know, of course, that the president himself has tested a positive and he's isolating mild symptoms. He's been double vaccinated. We also know that tomorrow or Wednesday, the National Coronavirus Command Council is due to meet. They'll get all the presentations from the scientists, and then they'll have to decide ultimately whether we go into any stricter lockdown measures. Most of the scientists, most of the people that we've been speaking to on this program are saying we're not going to see any restrictions in travel. We're not going to see beaches closed, but we might see that indoor gatherings are limited somewhat. What do you sense could come out, and what do you think would be the right decision scientifically to make?
I think amongst my scientist colleagues, there's complete consensus now that there's no role for any form of lockdown other than perhaps for some restriction on indoor gatherings. And that doesn't necessarily have to be a legal restriction. It's just what any sensible person should be doing at this stage. Is just don't, if you are indoors, just open the windows, open the doors, just get as much ventilation as possible. And if you're stuck in a lift or you're indoors where you're feeling unsafe, put on a mask, the best fitting mask you can. That's about it. It's really not that difficult. And if you're around people who haven't got vaccinated yet, encourage them to get vaccinated as quickly as possible. It's not that difficult anymore. All the other stuff that we used to recommend is much less important. The sanitizing, the wiping of surfaces, all that stuff is way down on the list. That's the stuff, is ventilation, mask, vaccination. Just get that stuff done. What happened to the president? Very mild disease. He had his vaccination earlier this year. That's the story from almost every single person I know who's been infected. Every story I've heard is a little bit of a snotty nose, feeling a bit tired, some muscle ache, back at, feeling much better 2 or 3 days later.
Do you think this is the end, potentially, of this pandemic? Could Omicron actually sort everything out and make this a very mild endemic disease?
There is a theory, and it's a theory. I think many of us scientists have been taught a lot of humility about this virus, that in fact that this is the stress test for what happens here, is that if Omicron stresses South Africa, a country that's had very high levels of infection, not only about a third of the country's been vaccinated, but if we sail through this with our hospital systems intact, this might be the stress test that we need going forward. And then we can start reverting to a period where we start treating it like the seasonal flu, where we do put in measures. Perhaps we mask up a little bit better. We have surveillance systems telling us when the surges are coming. We have vaccinations schedules where we vaccinate perhaps the more vulnerable parts of our society 2 or 3 months before the surges happen. We start just reconfiguring our society, but not one where we're constantly living in fear in the way that we have at the moment. So we start imagining a normal South Africa again.
All right, I've just had a quick bit of information from my colleague Heidi Jacobs, and she's pointed to hospital admissions in the past 24 hours have gone up by 422. I think that's across public and private, and I think that's nationally. Just off the top of your head, is that quite a spike, or is that pretty much what you'd be expecting at this point?
It is what I'd expect. I think that we are going to see a spike in hospitalizations. As I said, just the sheer force of infection. There's one estimate that as many as 30% of people in Gauteng are infected already. That's millions and millions of people with the virus. So as I said, you just need a tiny percentage of that to be sick enough to go to the hospital, to overwhelm the hospital system. So we are going to see people occupying hospital beds. Within that, we just need to be quite careful about, saying that we just need to keep an eye on how many people are dying, how many people are infected, how many people are, how long those people are spending in those beds, and how sick they actually are. So we're going to be paying a lot of attention to the force of that infection. How, are those people progressing to ICU? How long are they staying in those beds? Are they just staying there for 2 or 3 days while we keep an eye on them? All those things are going to be really important things to focus on in the next probably in the next 2 or 3 weeks. And if people are being just watched for 2 or 3 days and they go home, that's wonderful news. If they're progressing to ICU, that's not wonderful news, and that we're going to need to be very careful about. So this is not a declaration of victory. It's just watchful waiting. But the fact that people are being hospitalized is not a surprise. As I said, just the sheer number of people being infected means that people will be hospitalized.
Yeah, you're absolutely right. Make such a good point. Thank you so much for your time this evening, Professor Francois Venter. And of course, let me just reiterate those numbers: 13,992 new cases in the past 24-hour cycle. That represents a 31% positivity rate. But if you look at the deaths so far, 11 deaths. Tragic, horrible, very sad, but nothing compared to what we have seen in the past. Let's hope that it stays low like that. Thank you so much.